Thank you, Kara and Koen, for your questions. I'll answer them in the order that you posed them. The first question, what definition of anxiety is being used? And do you know the prevalence of anxiety in the general population using the same definition? So anxiety was measured using a questionnaire, which is called the Utrecht Symptom Diary. And patients hospitalized at the UMC Utrecht received this symptom diary every day to fill. And they scored a symptom on a scale from 0 to 10. And this is a validated tool wherein scores of 4 or higher are considered clinically relevant. And I think it's important to clarify that we look at anxiety as a symptom and not as a disorder. And we don't really know the numbers of anxiety as a symptom in the general population. But the prevalence of anxiety disorder is around 10%, which is lower than the numbers that we found. The second question, how is a depressed mood categorized, assessed? Depressed mood was one of the items on the symptom diary as well. In what way will recognizing anxiety more often and in an earlier stage impact patient care? What is the intervention? So, if healthcare workers don't know if a patient feels anxious, it's not possible to do something about it. And there actually are many interventions available, and it can be tailored to the patient. If there's one thing we need to do, it is starting a conversation about anxiety, but also things like a massage, music, conversations with a spiritual counselor, or even medication can really help in the treatment of symptoms of anxiety and therefore impact the quality of life. A question about prevalence as well. Do you know the prevalence of anxiety in non-cancer hospital patients? So I don't know the exact prevalence, but it is an important question because being admitted at the hospital itself might make people feel anxious. As you may know, hospitalized patients are frequently awaiting test results or have to do diagnostic tests. So I can imagine that also influences anxiety. What we did do in our sample is compare our patients receiving end of life care in the hospital to patients receiving end of life care in a hospice. And we saw that the prevalence of anxiety was much higher in the hospitalized patients. So I think being hospitalized definitely can play a role. Do you know the factors, subjects, patients were most anxious about? I don't, unfortunately. But finding this out should be the next step in the conversation with patients in order to find a suitable intervention. And considering the difference in prevalence between in-hospice patients and hospitalized patients, I think hospital factors such as uncertainty and diagnostic tests might play a role, but it would be really interesting to do more research about that. Is anxiety always bad? That's a nice question because indeed it is not. One of the definitions of anxiety is that it is a biological response to threats to the safety of an individual. And it is very normal to feel anxious in dangerous situations in order to fight or flight. So I think it's also really important to normalize anxiety. And I think in most situations, especially when having a potentially life-threatening disease, it is very normal to feel anxious. But yes, it is also bad if it persists and if a person suffers from it. Thanks again for the questions.